Singapore has seen a spike in new COVID-19 cases this past month due to the Omicron XBB subvariant. With the infection wave expected to peak in mid-November, should Malaysia be concerned about this possible surge in cases? We speak to USM virologist Dr. Kumitaa Theva about the highly transmissible subvariant.
From what we know about XBB, it is as transmissible as BA5, which we saw in the country a bit earlier. The second question is, can it evade our immune system? And from what we know from research, it has been shown that it is probably the variant that is best at evading the immune system, which means that whatever you throw in its way, it's able to avoid it. But that's sort of expected because the longer a virus is in circulation, and COVID is going into its fourth year now almost, it does acquire a lot of new mutations, and as it acquires new mutations, it's able to avoid our immune system pretty well. This also means a couple of things. So the first is that it means that if you've never been infected before, there is a high chance that you might be infected with XBB. The second is that if you were infected during the early days of COVID with Alpha, with Beta, with Delta, you are also at a higher risk of being infected or reinfected with XBB. And the third is that if you last received your vaccine about a year ago, you're also at higher risk.
With the 15th general elections just around the corner, Kumitaa advises the public to continue practicing all public health measures, such as mask wearing and constant sanitizing of hands.
There probably is a very high chance that XBB might already be in Malaysia, and we may not have recognized it or realized it because people might be testing less. Those who do get tested may not be reporting it, and often it's usually from the PCR test, which is then sent for sequencing, where you're actually able to identify what type of variant is out there. But that being said, with Singapore and of course across different countries as well, you may see different numbers of cases depending on what type of COVID prevention measures you have in place. So with Malaysia, for example, even though we removed indoor masking a while ago, when you walk around, most people still are in their masks, which is a great thing. So everything that has worked for us before, all public health measures, masking, good hygiene practices, all those would still be able to protect us really well. Whether you're out in a crowd, whether you're going out to vote during the elections, if you do sort of sanitize your hands, make sure you're not standing around chatting in a big group, you should be okay.